Hi everyone, my name is Senani Ratnayake. I'm the Director of Learning and Engagement at P3 Veterinary Partners, but more importantly, I'm a registered veterinary technician. Being declared an essential service was a big deal, and so we've spent the last 24 hours or so celebrating that acknowledgement that in Ontario, animals matter and they deserve care during this unprecedented time. But now that that excitement is starting to die down, we have to stop and think about, so what does this mean for us as people? In the coming days, the OAVT will be providing you with ways to keep yourselves, your team, and your families healthy and safe so that we can ensure that clients still have a good experience and pets get the care that they need. We are the superheroes of the animal world. We're blessed to benefit from compassion satisfaction. Compassion is one of my favorite words. It isn't just about having feelings for somebody else's suffering. It has an actual action associated with it. You want to alleviate that suffering. Compassion's a gift. We're not only blessed with the ability to be extremely compassionate, we also take great satisfaction and we get a feeling of contentment from being compassionate. And at a time like this, there are reasons to be compassionate. There are reasons all around us, potentially too many reasons. Being declared an essential service was the government showing compassion for pets and animals all over the province, and we are so grateful. But now the real work begins. It's going to be a long haul. We'll continue to be there for the animals, but we do have to also focus on keeping ourselves safe. A COVID-19 positive or self-isolating team member isn't nearly as effective as a healthy one. But of course, health isn't just based on whether or not you have COVID-19. I'm not a big fan of talking about compassion fatigue and professional burnout, partly because I'm not an expert myself, but also I fear that sometimes we use these terms haphazardly. There are lots of different things that can cause stress, that can cause your emotions to rise and your anxiety to build and your frustration to develop. So we have to look at the fact that we need to understand these different types of stress. There are lots of different situational stressors out there. Moral stress is an example of that. When something external is limiting our ability to act according to our own moral compass. We know what is right, but we can't necessarily act on it. That's moral stress. And we're seeing a lot of reasons for moral stress now in North America and across the world. In some countries, human doctors have literally had to make decisions as to which people live or die because they don't have access to certain resources like ventilators, so they can't save everybody. That's an extreme example, but we don't have to look far to see reasons for stress to build in our own environment. Our ability to show compassion the way we normally would with our clients when we have a closed door policy is going to be difficult. Social distancing makes things difficult. Having to give someone bad news while we stand 2 meters apart or through a window or on a phone is so different to what we're normally used to, and it might weigh on you. Euthanasias are an example where we spend so much time trying to perfect that experience. And we feel strongly about having that experience go a very specific way. But at a time like this, it's difficult, no matter what your current hospital policy is, to maintain that safe social distance, to do all of the things we're supposed to be doing and still create that experience for the client. And for some of those clients, they may actually be in self-isolation. Maybe they can't even be with their pets during this difficult time. These are examples of stress that we're going to start to encounter. People's financial stressors are going to become our stressors. In other cases, you're going to be dealing with clients afterwards where maybe we do let them into the hospital, maybe we do let them stay with their pet for the euthanasia, but then there's the stress that comes from now we have to disinfect everything and make sure that we minimize our exposure and our team's exposure. Supplies are diminishing in some hospitals, and we have to be careful to conserve PPE. In other cases, and we've seen it in other places, human hospitals are coming to veterinary hospitals and asking for that PPE. And we understand that. We understand that human medicine needs these things, and that's great. But at the end of the day, there is going to be a little stress as we think about, so what about the animals? All of these things create stress. In the long run, it's temporary stress for a good reason, and we know that, but it's still real. The fact of the matter is, it's not a bad thing to experience stress. It's a bad thing not to acknowledge it. Identifying our stressors, that's a positive measure. More importantly, we need to figure out how to combat the stress. There's so many choices that each one of us is making every day right now, personally and professionally, as an individual, with our teams. Throughout the day, you make choices to do the right thing. Some of you're getting pretty creative lately. Let's be honest, you're finding all sorts of crazy ways to pull off doing the right thing. So now, well, let's make up a phrase. I want to combat moral stress by finding moral satisfaction. Can you figure out what change did you make today that enabled you to do the right thing despite the barriers? You need to be healthy to take on each new day. And we talk a lot about healthy immune systems, but what about a healthy emotional system too? What are you doing to focus on the positives? Something as simple as reflecting on each shift as you head home. What went well? What did I achieve? Who did I help? How did I help? What was my positive impact today? Often when somebody asks you how your day goes, if you're anything like me, you're pretty quick to jump to that one thing that didn't go the way you wanted, the one thing that didn't go to plan. And so I was wondering if maybe in this era of COVID-19, we can challenge ourselves to stay away from that negativity, to focus on what went well, because we're all here. We're capable of helping animals, and we're capable of helping the people who are connected to those animals. And whether you work in a small animal environment or a large animal, research, shelter medicine, if you're an industry team member, we're all helping. We all have the ability to help in some way, and we've been given the green light to do so. Those animals, they bring joy to people every day. So when you help an animal, you are helping them to then bring joy to somebody else. That's you. You're having that impact. I'm not a psychologist. I'm not an expert on mental health. Luckily, I don't have to be. The OAVT members, we all have access to complimentary services and experts through our member assistance program. And I know some of you have heard about this already and you've already tapped into the services, but there are many of us, frankly, who have never really had to use them before and we aren't as familiar. Whether it is concerns about finances at this time or mental health, maybe it's just nutrition, elder care and child care, addictions, legal advice, they have all sorts of resources available to you. It's confidential. You can access it 24/7. There are articles online as well, hundreds of them, or you can actually tap into it and speak to someone, e-chat, by phone, whatever your preference is. It's important to recognize that many of us consider ourselves to be quite emotionally strong. And so we tend not to burden the people around us with our worries or our concerns. For some of you, you might just need to talk to someone who can validate your feelings during this current reality. And for others, you might just actually have a question about what's happening right now within our province and how it affects you. There is so much happening day to day and it's changing so quickly, it really is frankly hard to keep up. I was really happy when the OAVT asked me to help and connect with you guys. All the news about veterinary medicine being an essential service was pretty exciting to me, and I want to get started, but I want to make sure we're all doing it the right way. Anybody who knows me knows I care about this profession more than I have words to describe, and I also care immensely about the people in it. RVTs matter. We are critical to pet health in so many ways, so please, I encourage you to do whatever it is you need to do in order to take care of yourself so that you can stay at work, stay safe, and support your communities. You'll find information for the member assistance program on the OAVT member portal. Please don't feel shy to access these things if you feel you need to, or you just want to have a little dig around and see what's there. If you know somebody who would benefit from the information in this video, tag them. Also, I would love to hear about your moral satisfaction stories. What have you done that allowed you to continue doing the right thing? Share a positive story or a moment from your day below, because I think all RVTs could benefit from sharing in the good during this time. Thanks everybody. Stay safe.